This presentation is on hypertension. What is hypertension? Most people know hypertension as high blood pressure and is shorthanded for HTN. When we look at someone's blood pressure, there are two components, or two numbers, and written as a fraction. The systolic blood pressure, which is the upper number, this is how much blood pressure is exerting against your artery walls when your heart is contracted or pumping. The diastolic, which is the lower or bottom number, is how much pressure is exerted against your artery walls while your heart is at rest. Here are some stages of blood pressure. A normal blood pressure is less than 120, and the mmGH stands for millimeters of mercury. So 120 over less than 80 is a normal blood pressure. Elevated blood pressure, or what they call pre-hypertension, is between 120 and 130 over less than 80. And then we start getting into the stages of high blood pressure. 130 over 180 is considered high blood pressure. And your blood pressure can get higher and higher. And then when your blood pressure gets 180 over 120 or higher, then this is an emergent crisis. So why is hypertension so bad? Well, for one, people don't know that they have hypertension unless they've had their blood pressure checked. Another name is called the silent killer. So the high blood pressure or hypertension over time damages your body organs, including the cardiovascular system, so your veins, your heart, and other things like your brain, which you can get a stroke from the high pressure, which can release some type of a clot or just the pressure over time. And it can also make an enlarged heart, damage the kidneys, that extra pressure against the filtration system, and so roughly half the people with untreated hypertension die of heart disease, which is poor blood flow inside the heart, which causes ischemia, and ischemia is lack of blood flow, and that which kills muscle. And then the third is they die of a stroke, which we talked about. Hypertension is a major risk factor for, here's a list: coronary heart disease, peripheral vascular disease, renal disease or kidney disease, and cerebral disease. This is all because of the excess pressure in the blood vessels exerting against these body organs. So there are two types of hypertension: primary hypertension and secondary hypertension. Primary hypertension is what most people have, and it is idiopathic, which means there is no identifiable cause. So 50 to 65 million people in the United States have it. Secondary hypertension has an identifiable cause and only accounts for 5 to 10% of adults. And usually the cause is some other disease process that is causing the hypertension. Okay, primary hypertension risk factors. So we have non-modifiable and modifiable characteristics. So the non-modifiable is age. If you're older than 50, if you have a family history, which is a close blood relative that has high blood pressure, if you're African American, you are 2 times higher likely than Caucasians to have high blood pressure, and gender male. So these are all non-modifiable characteristics that put you at risk for hypertension. Modifiable characteristics are obesity, so being overweight, smoking cigarettes, high stress, drinking excessive alcohol, having hyperlipidemia, which is high cholesterol and high lipids, increased intake of salt or caffeine, low activity levels, which is followed by a sedentary lifestyle, and diabetes mellitus, which mostly likely is type 2 diabetes. Secondary hypertension causes, which I talked about a minute ago, secondary means that there is another cause, another illness that is causing you to be hypertensive. So cirrhosis, which is liver damage, renal disease, which is kidney disease, coarctation of the aorta, which is stretching or enlarging of the aorta, it's a thinning. It's a constriction of the aorta. Some endocrine disorders like Cushing's disease, which your body creates too much cortisol, and being pregnant, pregnancy-induced hypertension. Hypothyroidism is also a cause. Sleep apnea, or trouble sleeping at night, when you breathe and then suddenly stop breathing, that's sleep apnea. And drug use or medications, like high use of estrogen and oral contraceptives and other steroids like mineral and corticosteroids, can also cause secondary hypertension. So, manifestations. Usually, it is asymptomatic, which I said earlier is the silent killer. People don't usually know they have hypertension unless they have it really bad or they've gone to the doctor. And a lot of times it is caused by secondary hypertension. And then, as we talked about earlier, when they have a systolic blood pressure higher than 120 millimeters of mercury, it is an emergency. And here are some signs and symptoms. So dizziness, disturbed vision, palpitations, which is a fast or irregular heartbeat, angina, which is chest pain, headache, epistaxis, which are nosebleeds, flushed face, and tinnitus, ringing in the ears. All of these are caused by the excess blood pressure on these organs. So prevention. So what do we do to avoid hypertension? So the first is maintain a normal body weight, or if indicated, lose weight if you are overweight. A lot of things we can do dietary to help reduce hypertension. First, a diet rich in fruits, vegetables, and low-fat dietary products. Reduce your sodium levels to less than 2,300 milligrams per day in a healthy adult, and less than 1,000 per day for someone who has hypertension. And we can reduce processed foods, which are high in sodium, canned foods, frozen dinners, and processed meats. And then limit alcohol to 1 drink if you have hypertension. You can Also, additional to diet, engage in aerobic exercise for 30 minutes, 3 to 6 days a week. Higher if you have hypertension, or more days. Smoking cessation. Taking hypertension medications properly. And some of those medications are beta blockers and diuretics. And stress reduction activities. Yoga. All those kind of things that we've talked about in this class. So there is a dietary approach to stop hypertension called DASH. So if you have hypertension or preventing, so they use servings to get all of your nutrients in a day. So grains, 6 to 8 servings per day. Fruits, 4 to 5 servings per day. Vegetables, 4 to 5 servings per day. Drink fat-free or low-fat milk or milk products of 2 to 3 servings per day. Meat, poultry, and fish, 6 or fewer servings per day. Nuts, seed, and legumes, 4 to 5 servings per day. Fats and oil, 2 to 3 servings per day. Sweets and added sugars, 5 or fewer servings per day. Conclusion. So the things that will help us not have hypertension is a regular diet, a good regular diet, regular exercise, and seeing your healthcare provider on a regular basis. And then if you are prescribed medications as indicated, then maintaining a correct medication regimen. Thank you.